Now, having talked about the Freud's psychoanalysis, and then we have the other techniques such as the Gestalt therapy, all of these therapies are basically based on the fact that we are basically treating the people who are having the mental disorders by the counseling sessions and by the psychological techniques rather than devising pharmacological treatments for these patients. So, if the patient is suffering from a mild or moderate form of a disease, he or she can be treated through these techniques successfully. So one should know these different techniques at hand, and basically depends upon the psychiatrist as well to decide on which person we're going to use what kind of a technique. So over here in this section, we are discussing the Roger person-centered technique that is being used. The person-centered therapy will be discussed over here, and then we're also going to discuss the different modes of the self-defense mechanisms that are being devised by these individuals. So this is basically the center or the crux of this section that we're going to talk about. The Roger person-centered therapy, how do you go about and define this therapy? What are the key features that are related to this therapy will be discussed over here. And then we're going to move on to the humanistic approach of treating these patients through these psychological treatments. That will be also discussed over here in this section. And then we'll move on to the self-defense mechanisms that are devised by these individuals. One should know what are the self-defense mechanisms. Working as a psychiatrist, you should know that these are the self-defense mechanisms that are devised by these individuals to give these individuals the insight to their problem. It is very important to deal with these self-defense mechanisms and how to go and cope with these self-defense mechanisms. So this is what we're going to talk about in this section. Now, when we define this Roger person-centered therapy, it is a non-directive insight therapy in which the client does all the talking and the therapist just listens to the patient. So basically, it is just giving an outlet to the patient's thoughts and to the feelings and to the emotions that he or she is suffering from. So this is basically just a catharsis that is provided to the patients by the therapist. So this is the mainstay or the key feature when we are dealing with patients who can be treated with this Roger person-centered therapy. Now, it's a non-directive therapy. No questions are asked by the psychiatrist who is dealing with such patients, and usually the therapeutic style in which the therapist remains quite neutral. He or she is not biased with the thoughts of the individual. He or she cannot be judgmental about the thoughts of the patient that he is dealing with or counseling. So basically they do not take direction or actions with regard to the client, and they remain calm, non-judgmental listener while the client talks about their feelings or their emotions. So what are the key features of this Roger person's centered therapy when we're applying it on a patient? It's basically a state of self-actualization that is carried out in these patients. You're living to your highest potential. The self-esteem is also raised. You have acquired the skills that lead to honor and recognition, love and belonging. So this sense of love and belonging is also aroused in the patient, achieving the deeper meaningful relationships. So this is helpful, and safety and physiological needs are also catered over here. Now, when we talk about the physiological techniques, it can be the home, it can be food, water, and sleep. So these are the physiological needs of the individual that should be catered on when you're treating these individuals. So these are the mainstays or the key features of this therapy. You have to raise the self-esteem. You have to basically make the patient go in a state of self-actualization, meet his physiological needs at one end, and arouse the sense of love and belonging in the patient as well. So these are the key features that we have already talked about. Then the 4 elements over here can be the authenticity, genuine open response of therapist to the client, unconditional positive regard, warmth, respect, accepting atmosphere created by the therapist. Then the empathy is again very important. Empathy is basically putting yourself in their shoes, is basically how do you define empathy. So, ability of the therapist to understand the feelings of the client, reflection is very important. The therapist restates what the client says rather than interpreting. So, you just have to repeat what the patient says, and this is known as the reflection. So, this is the technique, and this is the key elements of this technique when we are dealing with patients of certain mental disorders that can be treated by the Roger Person-centered therapy. So basically, it is a motivational interviewing that we are talking about over here. So the motivational interviewing has specific goals to reduce the ambivalence about the change and to increase the intrinsic motivation to bring that change about. So usually we are treating with a range of age groups. It can be the adults, the children, even the people who are belonging to the old age group are sometimes treated with this Roger Person-centered therapy. When you're giving them an outlet and you're raising their self-esteem, they can be treated in quite a positive way. Now, when we look at the primary care setting in which this technique can be carried out, usually what happens is this is the normal primary care setting in which diseases of mental disorders can be treated. The federal, state, or the private sector policies are again very important over here. Then the organizational support. So the support at the federal level, and then we have the support at the organizational level is again very important. We have the health system leaderships, the coordination with the external entities is carried out, financial and performance monitoring is being carried out in different organizations. Delivery system redesignings are being carried out. Then we basically divide these people into the providers and then the patients. The providers, they give out the decision support over here, and that the patients can have the self-management support over here. It links to the community resource specialty mental health. The clinical information systems, they basically provide the population panel management. It is shared by the electronic health record, and there is basically a stepped care that is being carried out when we are taking care of these individuals who are basically suffering from some sort of mental disorders. So the humanistic approach, when we talk about it, the humanistic therapies are not based in the experimental research and work best with intelligent, highly verbal persons. So one should know when to apply these humanistic approaches. It cannot be applied to people with low IQ or with other disabilities. It can only be applied with people that have the high verbal accounts. So this is the highlight over here when we talk about the humanistic approach or the humanistic technique over here. So the different self-defense mechanisms that are devised by the individuals are the repression or the denial. Then we have the displacement, projection or rejection, reaction formation, rationalization, sublimation, and identification. One should have an insight towards these self-defense mechanisms to deal with patients who are suffering from the mental disorders. So this is the key features over here. One can have the anger, the worries, and the sadness at the other hand, and all of these are due to the poisoned thoughts of the individual. So this is how basically a psychiatrist deals with these anger, worries, and sadness. These are the different emotions that are being faced by the person who is mentally ill or is mentally disturbed. So this is the end of this section. Thank you for watching sqadia.com.